Happy that you're here, and I hope it will be an interesting session and discussion on how we can achieve satisfaction in our patients after surgical treatments. And we'll especially have a look at the role of expectations of our patients. So we'll have 3 talks today. The first will be not by Emin, but Uge will step in about spine tango and how this tool can help us to measure satisfaction and improve our clinical practice. And then we have 2 talks focusing on different pathologies and see how expectation may vary in these 2 different pathologies in terms of what patients are expecting from surgery and how this influences their outcome. So we want to reflect on what satisfaction actually is, learn how we can measure it, discover which tools in spine tango can help us to understand all these things better, and see how the difference is between degenerative diseases and adolescent scoliosis. So what is satisfaction? So when I started to prepare this session, I was looking in the Cambridge Dictionary, and what I found is that it's a pleasant feeling that you get when you receive something you wanted. So the patient is getting the treatment he needs, and his treatment goals are achieved. But the second definition is also if you have done something what you wanted. So it's also the surgeon who is satisfied if he did manage to do a good surgery and having a happy patient after all. Expectations of the patients may vary a lot, being the individual patient different, the age, the pathology, as I said, and there are a lot of factors that might influence outcome and satisfaction. Just to list some here, like the age, the pathology, the treatment and complications, of course, the radiologic outcome, but it's a lot about individual characteristics also, like the gender, is it a smoker, does the patient have osteoporosis, his employment status, his level of education. So it's very different factors which we also have to consider when we talk with our patients. And after all, we want to end here to have a happy patient, and then we are happy as a doctor, hopefully. And as I said, it's important to measure satisfaction and to really objectify this. And within EUROSPINE, we have a great tool with Spine Tango, and I'm happy for Uge to tell us how this tool can actually help us. So.
Hello, everyone. I'm covering for Emin today, but I can talk to you about patient satisfaction in Spine Tango. So Spine Tango covers PROMs for patients. So we get patient-reported outcome measures and that are used in the application. So when a surgeon is recording information about a patient, one of the first things that's done is they send out the EPROMs for the preoperative scores. So we understand how the patient actually feels before they actually have their surgery. And then post surgery, we also send out the same forms. So we find a way to measure how they feel at different intervals. So as you can see, we use the COMI form, which is the Core Outcome Measures Index, with 7 items that we ask the patients to try and determine how they feel before surgery and after surgery as well. We have an additional 5 items post-op that are included to find out the feelings questions you can only ask, which are post-surgical questions. So these forms are validated in lots of different languages. It's multilingual in the application, so depending on what language you speak, there are various languages that are available in the application to enable the patients understand the forms. So patients are sent out forms are sent out to the patients. They can choose whatever language it is that they speak and answer the question so that you make sure you get the adequate responses to the question rather than patients having forms in languages that they don't understand, where questions might be subject to misinterpretation. So as you can see, we have the patient satisfaction, where we ask how satisfied were you with your care in the specific hospital where you've gone. And these are the options that you have. They range from very satisfied to very dissatisfied. And then we also do the global treatment outcome, where they ask how the operation and the hospital helped them with their problem, and they can define that. And in the course of doing that, we do analysis as well with the information that's returned. We get the questionnaires received, do the analysis based on clinics. We can also do them at country level, where you can actually compare the satisfactions based on your geographical region to see how patients compare across different regions as well. So we have global treatment outcomes for 12 months and at 3 months. So we do preoperative first, and then at 3 months we ask the same questions, and then at 12 months we come back to measure what the differences are between how they felt at 3 months and then at 12 months to ensure that their treatment path has been actually successful for them or otherwise. And that information is fed back to the clinicians as well. We do the analysis on that information, send that to the patients so that the surgeons understand as well the way in which the patients are responding to the treatments they had. So a patient outcome is really quite important in understanding the various ways in which things can be improved, and it's essential to track that information because we don't just want information about what surgical procedures were done and how those things were done. We also need to understand how the patients feel, and the COM is a really good measuring tool that we use to do that. So you find that sometimes you have discrepancies in outcome ratings which are influenced by the seniority of the surgeon or the patient satisfaction. And you might have sometimes, there are various things that could happen because you might solve one problem for the patient and they have a different problem which might affect their satisfaction scores. But in general, we're able to get a good idea of how they're responding to the treatments that they've received. So we're able to get a balanced view of the surgical results and outcomes, and which can be assessed from both the perspective of the patient and the surgeon. So you can see the breakdown of patient satisfaction by country and surgery type, and we're able to get all this information out of Spine Tango as well. So the information we have is quite in-depth and quite varied, and we're able to show you the picture based on geographical region, like I mentioned. So you'd see that we have for decompression surgeries, you can actually look at them by pathology type, break that down into the results that you're getting, and are able to see whether you get more benefits from one particular type of surgery as opposed to another. So the patient satisfaction is available at follow-up. We adjust it for patient age, gender, the ASA grades, smoking status, and the number of previous surgeries as well that are done. And you can see that the results are very comparable between countries and surgery types after we've done a few adjustments. So this is not published data, but this is data that is available in the Spine Tango database for which we can produce that information. So the more data we collect for our patients and about the surgeries, then the more results we're able to produce, and those results will eventually get validated because you've got volume of data with patient outcomes, and we find a way to measure that. Okay, so there are further studies and analyses that are required for us to test potential influencing factors, and these things are also collected. In some cases, we collect the education level to find out if that is a factor that influences the way in which a patient responds to the questions that are asked of them. So we can measure them at different levels to see what the expectations could possibly be. We look at all the different instruments that are used and look at the different hospitals, lots of other information that we have. So I think that's the end of the talk, and I hope you found that useful. And if you have any questions, please contact the Spine Tango team. We're always very responsive, and we can help you with analyzing the data that's in there. Thank you.
Thank you very much for this talk. I think that's really an invaluable tool. As you said, it helps us to measure satisfaction in our patients, but it also gives you some benchmarking criteria as a surgeon, and you can see how you perform as a surgeon. It helps to reflect your clinical practice. And I think as you have to hurry on, as Spine Tango team has unfortunately another session. If there are any questions, you can always reach out to the team, I think, and also on the webpage of EUROSPINE you find a lot on Spine Tango. So if you're not participating yet, please have a look there, and thank you for being with us. So I'll go on and have a closer look on degenerative pathologies and how expectations influence the outcome in these patients and what factors we have that influence satisfaction after surgical treatment. So there's a whole lot of data on these things, but I just try to pick out some studies to have a look and give you like a short overview of that. So if you think about satisfaction, we have to think about what are the criteria for success. And these may actually vary a bit between the patient and the surgeon. So the patient, of course, is interested in a reduced pain. That's his main motivation probably to get surgery in degenerative pathologies, that he wants to get rid of his pain. But we already have to consider that there's a difference between back and leg pain, and we can treat them not the same way or not in the same good way as we can treat them, as we see later. Then it's of course the disability or mobility of the patient, where again the goals of the patients may vary a lot. Is it to return to work, return to sports in a younger patient, or maybe an older patient who wants to be able to go shopping or for a short walk in the park, so that we have to consider what the expectations are there, and overall the quality of life, of course, for the patients should improve. As surgeons, we are also interested that these criteria are successful for the patients, but we don't really feel it that much. Spine Tango helps us, for example, to measure it in a better way. But as a surgeon, at the very first place, after surgery, probably you're looking at the radiographs and say, oh, I did a nice surgery, the sagittal balance is good, we did a good lordosis, which is not the primary criteria for the patient probably. Or to get a solid fusion. Patients are not thinking about, do I have a solid fusion? They only think about it if I have a pseudarthrosis and then have pain. And also the complications for us as surgeons, we are happy if we have an uneventful, quick surgery and everything went well, then we are happy in the first place after the surgery. But that, for the patient, the story goes beyond that, and we really have to look how we can keep up satisfaction on the longer term after surgery. And there are a lot of individual determinants which can influence the satisfaction of the patients. And I just took out one study there looking on spinal stenosis and the outcome. And they found a lot of different criteria like age, previous surgeries, smokers, employment status, which are individual characteristics and influence the outcome of our patients. So we don't really have an influence on that. But we have to consider it when we talk it with our patients before surgery. What the authors mentioned, that satisfaction is a complicated measure of treatment success. So it has really a lot of influences, and it's not just one parameter we can have to consider. For example, it's also, again, the difference between back and leg pain, which is on the lower side. So if back pain is the predominant pain and the patients are expecting to have a lot of improvement in back pain, they will probably be less satisfied after surgery. So we have to really counsel our patients in these criteria and things to inform them what chances of treatment success they have after surgery or what they can expect. Then, of course, the underlying pathology plays a role. It's a difference whether you have a lumbar disc herniation or a stenosis, or also if the reason for a spondylolisthesis, if a degenerative listhesis or isthmic spondylolisthesis plays a role. Just picked out one study here where they again found that a degenerative spondylolisthesis with leg pain would produce the most satisfied patients, whereas the back pain as a main problem had less satisfied patients again. Then, of course, as we all know, psychological factors play a role. Depression symptoms play a role in patients with degenerative diseases. Just one study to show that surgery for spinal stenosis could have a relieving effect on depression symptoms. So if the patients are probably depressed because of their not ability to walk and so on, and if they improve, it can have relieving effect, but the persistence of depressive symptoms after surgery correlates with a worse outcome. And again, unmet expectations, so the patients probably expect more from the surgery and won't be satisfied in the end. So there's expectations before surgery, a really important factor, and there are also some studies on that topic. This one is already published 2009 by the group from Zurich, again working with the Spine Tango registry, and they compared different theories of the role on expectations. One which was that high baseline expectations per se yield better outcomes. The other was that the fulfillment of the expectation is of paramount importance. And the third one, that the actual improvement in symptoms governs the outcome, and it's not so much important what the patient expects before. And when they looked at their results, they saw that the expectations of the patients were overly optimistic in almost half of the patients. So they were probably not counseled that good before surgery. And the statistical analysis revealed that the expectations being fulfilled was the most important predictor of the patients being satisfied and have a good global outcome. So really have to set realistic expectations before surgery when we talk to our patients. This is another study published just a year ago, still focusing on the same problems. And the author, several years after the first study has shown, still states not completely understood how these expectations influence our outcomes. And again, they looked at this effect of expectations. And what they found, that satisfied patients with spine surgery improved functionally to a much greater degree. Yeah, that's not very surprising. But again, higher expectations with regards to disability. So the patients satisfied with surgery tended to have higher expectations in regard to disability improvements and lower expectations in regard to back pain. So if you don't expect your back pain to disappear after surgery, patients will be probably more satisfied, whereas we can improve them better in disability and their functional improvements. So again, this preoperative counseling was in the conclusion of the paper, and I'll come back to that several times because that is probably really an important factor. And they also stated that we really have to think about counseling techniques and effective communication. I think spine tango can be one thing you can use in your clinics to educate your patients better, and could be a technique to improve that. Then that's important is this concept of the expectation actuality discrepancy. So it has been shown in that review study that if the actuality discrepancy is low, patients will be higher satisfied. So what does that mean? If you look at that graph, the dashed line is the expected outcome of the patient. If it's far below them, we have a high discrepancy, and of course the patient won't be satisfied. So we have to again set realistic outcome expectations for the patients. And what is interesting to see again is that differs again between pathology. So they compared lumbar disc herniation and lumbar spinal stenosis. And what they saw that in patients with a lumbar disc herniation, if they had a higher expectation prior to surgery, they actually did better after the surgery. Whereas those in lumbar spinal stenosis, higher expectations were associated with a less satisfied, worse outcome. And overall, the expected outcome is far too high in lumbar spinal stenosis, where it is closer to the actual outcome in lumbar disc herniation. So we really have to inform our patients about these things. And again, often they exceed the actual outcome. And then there's another thing, we have also dissatisfied patients, although they improved clinically to a meaningful way. And this is again probably something about expectation not being met. And that's a large registry study including more than 34,000 patients undergoing elective surgery for degenerative spinal pathologies. And they all improved clinically into a meaningful way, but nearly a third of the patients still were dissatisfied with their spine surgery actually. And they found several modifiable factors like psychological distress again, the smoking status, or the failure to return to work or physical activities, which help to explain why the patients are still dissatisfied with their surgery, although they had less pain and were better mobile. So, and the most important factors were the return to work and return to previous physical activities. So probably a patient with a lumbar spinal stenosis can't expect to reach his level he had before 10 years if he is an older patient, because there are other factors like maybe a heart disease or other pathologies which limit his ability to do sports or to walk longer distances, and not only the spinal stenosis. So we really have to set these realistic expectations for our patients. And also the authors suggested to have a multidisciplinary approach in rehabilitation again, which is looking at what the patient is trying to achieve with surgery before and after surgery, and try to guide them to reach his goals after surgery. So in conclusion, it's important to counsel our patient and ask actually for their expectations. We have to ask our patient with a lumbar spinal stenosis, do you expect to improve a lot in your back pain, or do you expect to be able to walk longer? And what do you think, how much longer will you be able to walk? And explain to him, okay, maybe it's not only your spinal stenosis, we can treat that, but it's all the other different pathologies which play a role. You haven't been for more than a few hundred meters for 5 years, and we do the surgery, we won't be able to do that right away after the surgery because your muscle status is not that good after all. We have to consider back versus leg pain because we can treat probably good radicular pain, but not so much the back pain. And again, employment and return to activity, sports activity, have to be informed, and the patient, we have to ask them, and then to get a set realistic expectation when we go for surgery, so that we all have satisfied patients and hopefully satisfied surgeons. So I thank you for your thing, and we go on with Miguel from Valencia. Actually, Teresa Bass should have been with us, but unfortunately she couldn't come to Vienna, and Miguel was so kind to step in for her and give us some information about what the role of expectations is in adolescent patients.
So, good morning, all of you. I'm Miguel. I work as a data manager and investigator in spine unit on Hospital Universitario Politécnico de la Fe in Valencia. And this is the topic of today, satisfaction for patients and surgeons in spine surgery, the role of expectations on outcome in adolescent idiopathic scoliosis. This is my conflict of interest. So, patient and surgeon satisfaction are critical measures of success. For that reason, we find different studies that have explored factors that contribute to long-term satisfaction. And the main important factors are clinical outcomes and overall treatment experience. So this is the index of the topic. And I start to speak about patient satisfaction in scoliosis surgery. This is the most important factors. We begin to pain relief. The most important is to reduce this pain relief. Many patients undergo surgery to alleviate chronic pain associated with scoliosis. Post-surgical relief from this pain correlates strongly with satisfaction outcomes. Another factor is cosmetic improvement. It's important in that patients that the body image is very important for these adolescent patients. Another important is the functional improvement. When this patient arrives to the consult, ask the doctor, when I restore my lifestyle? And it's all of this question. Another factor is psychological and emotional improvement. Surgery is important because these patients impact the surgery in this life, in these studies, in this sport, in this free time. And the last one is patient report outcomes measures, the PROMs. We use in Valencia Scoliosis Research Society 22, and many people use Tango. This test allows the doctors to see what is the satisfaction on the patient based on pain, function, self-image, and mental health. I don't know which test do you use. So the other part of this topic is the surgeon. We talk about the patient, and now we talk about the surgeon. One of the factors is important to surgeon is the technical success. The most important is get the surgical goals. So they get with a proper alignment and stabilization of the spine and the minimal complications. Another factor is the patient outcomes. Surgeons measure their based on how satisfied patients are with the result. Another factor is the complication management. Surgeons are afraid of potential complications like infection, heart failure, non-fusion that can occur intra or post-surgery. And the last one is the long-term follow-up. If the surgical correction remains stable in the time and patient improve their quality of life of the year, this is a good outcome. But to get satisfaction of the surgeons, there are different challenges. We look for three. The first one is the complexity of the cases. Surgeons work with more severe cases increase the risk of complication or suboptimal outcomes and less satisfaction. Another is the unrealistic expectation. In some cases, patient dissatisfaction may arise from unrealistic expectation about surgical outcomes. And the last one is the ethical consideration. Surgeons must balance the potential benefits and the risk of the surgery, especially in these cases with lesser curves. So we talk about patients, we talk about surgeons, and now we talk about the relationship between that. Clear communication and about expected outcomes, risk, and quality of life is essential. Surgeons who manage patient expectation have report higher satisfaction rates. To explain this relationship, there are two essential keys. First one is preoperative counseling. Surgeons need to spend time educating patients about outcomes, the recovery, and the potential complications. Sorry. And another case is postoperative care and the follow-up. Surgeons may continue monitoring, and postoperative rehabilitation are crucial. And to take home message, patient and surgeon satisfaction is multifaceted and interconnected. Clinical outcomes like car correction and pain relief are critical. Emotional, psychological, and functional improvement have a significant role. And I think the most important is effective communication and realistic expectation are the key to the patient, surgeons, and parents, of course. This is the bibliography that we use. So, thank you. This is the team of LAFE.
Thank you very much. So to summarize all of that, again, I think we really have to understand our expectations, see what the goals of our patients are. We need to measure it. It's good to monitor it, to be able to reflect on what you're actually doing in your clinical practice and have well-informed patients. So again, also from Miguel, he said it's important to inform our patients about the treatment. They have to understand what we're doing, but they also have to understand what their pathology is, and I think Spine Tango can be a great help. And it's not Spine Tango, Patient Line is a great help for that, because we have good information on several different pathologies, and you really can give that to your patients. They can read at home, and I think a patient who knows about his pathology better will understand his whole treatment better, and probably that can also lead to a better success. Patient Line is available in several languages, and its webpage is quite easy. I don't know if that video is playing, but you just go to EUROSPINE.org, and then there's on the top patients, and then you write on Spine Tango, and we are trying to keep that content. To add new content, we have webinars for patients also, and I really invite you to give that information on to your patients, and so you can use that. So that's here we are. That's the webpage. Just go on patients, and then you have all these spinal conditions where you can have a look at that, or the patient can have a look at. So it's quite easy to navigate. There's also just locate your pain, and you click on that area, and then you find diagnosis and treatment options there. And as you see, there are several different languages. So it's available in 6 languages now. That was video was done when it's not all we're online yet. So thank you very much for your attention, and I'm happy to answer any questions or on any comments how you feel satisfaction and expectations play a role in your clinical practice. Yeah.
Congratulations my name is Pinheiro Franco from São Paulo, Brazil. I think it's an extremely important concept. Today, in the day of information, there is not filter in internet. So the patients come with a lot of information and a lot of different expectations. And frustrations in psychology and psychoanalysis lead to process and bad things to us. We know that we do our best, but we are not gods. And sometimes patients, they think that we are gods, and we are not gods. So I think I have to congratulate you and your team and all the people that give value to this subject, because I think it's extremely important. I have my informed consent is of 5 pages, and I explain to the patient, and it's really I think we have to talk to the patient to avoid problems, because everything in life concerns expectations. When I came here, I had expectations concerning what you were going to talk about. And so, thank you. Just to thank you.
Thank you very much for that comment. And maybe if I just add on shortly on that, last year we had a patient line session on what patients are looking on in internet, and what you found out actually if you put in back pain, for example, you will end up in a lot of commercial web pages selling you some braces or whatever, but not really giving you the information you need as a patient. So really, I think it's important to guide our patients on the huge area of the internet to find the information they need. Thank you. So then, I hope all your expectations have been fulfilled today with this lecture, and wish you a nice day on the Congress. And hope to see you in the evening on the Congress evening.